Hello, everybody. This is Lori Crow, and I am a full 30 minutes late because I am a newbie at this Be Live broadcasting system. But I want you to know I'm very excited to share a special guest today, Dr. Alexandra Deibel. She is with the Medical Healing Center here in Tallahassee, Florida. And yesterday I posted an interview with Dr. not doctor, she's a nurse practitioner, Angela Myers, and the owner of the Medical Healing Center. And today we're going to talk with a board certified family practice physician and functional medicine doctor. Dr. Ola, lovingly called by all of her patients, comes from originally from Poland, but moved here from Wichita, Kansas, and is now living in Tallahassee and is a local gem for us. So I just want to thank you so much for your time and for hopping on with us this morning.
Thank you so much. I'm excited to be here. Thanks for inviting me.
This is exciting because in this group, we are looking to get healthy from the inside out. And so we wanted to ask you some questions to help us to understand. To get us started, could you tell us the difference between traditional allopathic medicine and functional medicine?
Yes, absolutely. So traditional medicine is very diagnosis-centered. A lot of times we are diagnosed with an illness, and then a prescription drug is given to try to most of the time manage it. Very rarely will it completely treat or cure the disease condition, especially if it's a chronic illness, an ongoing long-term illness. Mm-hmm. I realized I was, so for 11 years now, I've been a physician. And shortly into my training, I realized that I needed more tools in my tool bag than just pharmaceuticals to be able to really reverse what's going on. I didn't want to just maintain the condition with drugs. Right. So that's why I chose to go into functional medicine. And functional medicine is really patient-centered. We look at everything, we know that everything is connected, and we try to look at the whole scope. I always pay attention to, and in functional medicine, we pay attention to diet and stress and allergies, and have we been exposed to any pathogens or toxins that may have caused an onset of a long-term or chronic illness. We look at things, illnesses really that have been going on for 3 to 6 months and even longer, to try to get to the root cause of them and try to bring the body back to a balanced, disease-free state. And oftentimes we do it as naturally as possible, using food as medicine, balancing the gut and bringing that back into, into balance and optimal health. And then I use a lot of supplements and herbs as needed as well.
Now that is amazing. So I've had my own personal experience in your practice, and I can attest that there's such a comprehensive approach, that whole, like, it's mind, body, spirit, the whole thing, but it's also, you have a specialty in the gut biome and in the flora and getting that. So what is the process that you go through with a patient when you first see them? I know that you don't just go for the one thing, but what is the process that you would go through that if they came in, what would they expect to experience?
Yes. It's interesting, actually, with gut and digestive dysfunction. That just came to me through the years of working with people who happen to just have a lot of gut issues, and it wasn't anything really that I was particularly interested in from the get-go. It was just something that I was seeing a lot of in practice, and then really knew that to really be able to be in a disease-free state, we need to make sure that the gut is healthy. The gut is like a portal to everything. We look at starting with the gut a lot of the times brings the body back into balance quickly. So when I start working with a patient, I really take the first visit to listen to their story. I want to know, the more information, the better. I really want to understand their life, how they live, how they eat, their stress levels, what all they're coping with. I want to know the timeline of their health history from birth to now. I want to know any car accidents, traumas, childbirths, surgeries, where they've hospitalizations along the timeline, to just see how events unfolded and to try to figure out why people are in the state that they are currently, and really, working on upstream causes, getting to the root of the issues. And so my first visit is really me listening. And then often we order labs. I order lots of blood work. I look at adrenals and thyroid health. I look at a lot of hormones, look at blood sugar levels and metabolism and other metabolic lab parameters. I also do a lot of stool analysis, looking at using functional labs, looking at the microbiome and seeing if there's any imbalances there with gut flora. So
that is incredible.
Testing we can do as well, looking at nutrients and food allergy testing. We have many great functional tests at our disposal.
Which is so incredible, because that is not my experience in a typical allopathic setting. It's usually so much quicker, and I'm not trying to bash allopathic. I just love the expanded availability of functional medicine that is really looking at the core unit of a human, just everything that's going on, because they are all interconnected. So we've talked.
Really,
go ahead.
Yeah. So it's because it's really personalized. It's really individualized. Sometimes I like to call this personalized lifestyle medicine. We see what's going on, with you individually, and can identify and create a treatment plan unique and specific to you. Because, one pill does not. It's not like one pill for an ill. One pill does not treat all these. We're so varied. Our genes are so different. Our biochemistry is so different. Our liver metabolism is different. I look at each person as, biologically, biochemically unique. So it's not like a one-size-fits-all deal. It's very personalized. Yeah.
Which is so true, right?
Yeah.
So you probably, I wanted to ask you about the numbers of people that you see with chronic illness, with autoimmune disorders, and how many people that you also see that really, I want to empower people to know what they can personally do, like what things they actually have control over to help themselves with things that make them feel powerless.
Yeah. That's a lot of my time spent with patients, talking to them to empower them to know that there's so much that they are in charge of, constantly in control of. And I assist in navigating that. And it's nice, of course, that the tests that we do really also help us out, of course. But there's just, I think when we acquire more knowledge and educate ourselves about it, we can really empower ourselves. We see how much and what all we can do. And of course, like we know autoimmune diseases are on the rise. And so there are tools and books that I recommend for patients to read, just so that they've got that knowledge and then they can put it into practice. And it's really applicable, and it's all natural, which is beautiful too. So
could you share those books with us, and I'll post them below as well.
Yeah. Yes. The one book that has really stood out for me, and I've learned a lot from, but it's written for the lay person, is by Dr. Susan Blum. Her last name is spelled B-L-U-M. She's a medical doctor, and she's a functional medical practitioner. And her book title is The Immune System Recovery Plan. The Immune System Recovery Plan. And she wrote another book called Healing Arthritis, which is more specific to osteoarthritis, joint pain, rheumatoid arthritis. Right. And then there's another doctor by the name of Dr. Amy Myers. She's also a medical doctor and functional medicine practitioner. She's quite well known in the functional medicine world. And she wrote a book called The Autoimmune Solution. And all three of those are just great. So I highly recommend them to everyone that I see with autoimmune problems.
Well, I'll definitely be putting those below because I know that we're always looking for resources. Yeah. And so you know that we are the Healthy Living Inside and Out kind of a group, and we teach and train to remove addictive and inflammatory foods, you know, the gluten, dairy, soy, sugar, caffeine, and alcohol for 30 days at least, just to kind of reset the body, and then add in nutraceutical grade foods, whole foods. We also add in, you know, fiber and help with elimination. We do some mild detox on the system for the liver and kidneys. And we try to teach and train them about eating. So how much of our healing, you said earlier on, you said food is medicine. How much of our diet plays a role in our health?
It's huge. It's integral. It helps us. It has everything to do with our health. And oftentimes I always think, you know, of food as medicine. Food is information for our genes. It helps our cells stay vibrant because that food is what our cells are made out of, our neurotransmitters, our hormones, all of it. And I always think about that in terms of you have 100 calories of two different foods. It's the same amount of calories, but let's say you have 100 calories of a donut and 100 calories of a broccoli. And that information from those foods is going to be different for our body. So even though the caloric number is the same, the information from those foods is way different. So that helps me really, like every fork full of food that we consume can either lead us down a path of optimal wellness and vibrant health or down a path of chronic disease and illness. So it's huge. Yeah.
That is powerful.
The program that you have is just fantastic. It is a reset. That's the thing. So yeah, it's great.
Thank you. You know, I know some people some of us are just like, we have these habits and it's kind of like, I'm never going to give up this or I'm never going to give up that. But, you know, as we start going down the road of health and one thing starts to feel better, it leads to the next thing and the next thing. And so our job, what we try to do is to just encourage, you know, we say progress over perfection. I'd rather you give up one thing than not give up anything because you feel defeated, right? And so anything that moves in that direction of health. So I want everyone to feel empowered in this, but I also want you to be educated that, you know, you're hearing from a trained physician that is saying you get information from the food. And I know we know that intellectually, but it is so critical to what our cells will become. It's like what we do today is going to affect what we become tomorrow. So you've told us quite a lot, and this is incredible. But I wanted you to speak about some of these supplements that you prescribe for. I know everything's individual, bio-individualized and all of that, but you had certain supplements that are just kind of like, I think everybody should be on these. And I would love to hear about those.
Yeah, so we know our current farming methods over the last 100 years have depleted the nutrients in our soil, and hence the food that we're consuming is not as nutrient dense as it used to be, unfortunately. But of course, growing our own food in our backyards organically is awesome. If we can do that, that's amazing. Or getting local food from the CSA, our local community supported agricultures. A lot of the food we get from the grocery store has been picked a week or so ago, and every day the nutrient content even declines over time with that. So so a multivitamin, a good quality multivitamin is great to have on board. And also I'd say fish oil is really beneficial, and magnesium as well. And Sometimes probiotics, depending on your past history. I'd say if people have been treated with antibiotics a lot, then a probiotic may be of benefit. Oftentimes I try to feed my gut microbiome with food, with vegetables, with prebiotics. So that can help create a very diverse, healthy gut flora. But yeah, eating a diversity of fruits and vegetables and all the colors of the rainbow also is part of that. But yeah, so yeah, multivitamin, fish oil, magnesium, sometimes probiotic, those are great.
So tell me about, you had talked to me specifically about magnesium glyphosate.
Yeah, magnesium glycinate.
You had said it was a miracle mineral. Could you expound on that? Because that captivated me when we were doing our mock interview before.
Yeah, we did a practice round before this. But yes, magnesium is a mineral that about 300 enzymes in our body depend on in order to work and exert their function. And it also helps us metabolize stress or adrenaline out of the body. It's a gentle muscle relaxer. It helps us sleep. It helps us make melatonin at night. So it's just a wonderful mineral to have on hand to take. I like, magnesium glycinate is a well-absorbed form, and magnesium citrate is another good form, especially if people are prone to constipation. And you might know it as natural calm that you find at the grocery stores. I try to avoid magnesium oxide. That's the one that is most commonly sold in our grocery stores and stuff. But it causes diarrhea. It's not really well absorbed, so it just moves out our bowels pretty quickly. But yeah, so magnesium's really a helpful tool to have, especially if we're under more stress and want a little bit of better, deeper sleep. So,
yeah, which I think we're all under stress right now. So it's actually magnesium glycinate, not what I said. And so I'll put some of that information. Now, do you have a favorite multivitamin that you like to prescribe? Do you have a particular company?
Mm-hmm. For women who are menstruating still, I like to use, it's called Fem1, and it's just one capsule a day, and the brand is Metabolic Maintenance. So that's my favorite. It's just got a little bit of iron, but it's got all the methylated B vitamins in it and a good dose of vitamin D and minerals. So I like that one. It's sometimes hard to, some of these multivitamins are like up to 6 capsules a day, and that's hard to adhere to and, take all the time. It's just the one every day. Yeah, there's a lot of, there's another for, I guess you could, women over 50, I like is the one multivitamin. It's another just 1 capsule a day by Pure Encapsulations. That's a good one. I like to kind of keep it simple and not have to swallow too many capsules at the time. It gets,
I love it that you're bringing up the methylated vitamins. So everybody, our protein has the methylated vitamins in there, and that is something that was an upgrade that was made almost 2 years ago. And so I just love that our company is really paying attention to the things that are the most bioavailable for us. And it's just a good confirmation. But if you want to add that extra, full spectrum of the vitamins, including eating whole foods, including doing all the right things, I'm gonna post those in the comments as well. But I have one last question about an herb called ashwagandha. Could you tell us? We have a product called Super Calm, and this one is Inner Calm, and it's a powder, and it has ashwagandha in there. And I wanted to hear from a medical physician the benefits of ashwagandha.
Ashwagandha is an herb that's been used for thousands of years out of India. It's known as an adaptogenic herb, and that really means that it adapts with the body's needs and responses in the way that it helps really balance our cortisol levels very well. We want nice high cortisol levels in the morning so that we get started with our day, get out of bed, get going. And then in the evening, we want them to dip down so that we're ready for bed and have a nice, deep, restful sleep. Often in our hurried, stressful, busy world, we tend to push ourselves. We get a little overtired. We can even be facing burnout. So ashwagandha is a helpful plant ally that steps in to help us maintain endurance and stamina. And if our cortisol is a little too low in the morning, it lifts it up into the ideal normal range. And sometimes we can be wired and tired in the evening, which means our cortisol is out of whack and imbalanced and probably too high at night. And therefore we have intermittent awakenings through the night. We're not sleeping deep. We're not resting. It's a really uncomfortable state to be in. And
You're right.
I've been there within my medical training and all of that, and residency and everything. But so it's nice because in the evenings, it'll help drop that cortisol back down to the normal range. Also, not only does it support the adrenals because of that, it supports a healthy functioning thyroid, and then it supports optimal brain function so that we don't have brain fog, we don't have this cognitive impairment. And so it's a really wonderful supportive herb.
I am so grateful for your time, for your information, for giving us tools, and for your service in our community. I would love to be able to connect all of us with you. So would you tell us, how can we get in touch with Dr. Deibel?
Yes, so I work at the Medical Healing Center here in town. The website is themedicalhealingcenter.com. Our phone number is 850-309-1665. You're welcome to set up a new patient appointment, and we can get started. Our front office staff can help you with determining costs and insurance coverage. We do take Blue Cross Blue Shield and Medicare. Unfortunately, we don't take CHP. However, if we need to draw any labs, that can be covered through CHP. So the office visit may need to be out of pocket, but labs are covered under insurance.
Excellent. So you are just such an amazing, hidden gem here in Tallahassee, but you also serve the surrounding area. And Angela told me that you've even had clients come all the way from Italy. So we have people from all over the country in this group. If you want to fly to Tallahassee and come say hello, we would love for you. We'd love to meet you in person, but also Dr. Deibel is available, Dr. Ola, however, to meet your needs. So don't think because you don't live directly in Tallahassee, it's a short hop, skip, and a jump from the surrounding areas, and they can service, your whole person. And that's what's so important when you're dealing with issues in your body, is not just the one thing, but the whole complete package. And so I just want you to know I respect you so highly. I'm so grateful for your time. And on behalf of everybody in our group, we just want to say thank you for sharing all of your wealth of information with us today.
Oh, you're welcome. Thank you for having me. Thank you so much.
Okay, so I'm going to post the books and the website and all the information in the comments so that everybody can get in touch with all this and the supplements and everything. So be on the lookout for that. All right, everyone have an incredible day. Bye-bye.
Bye-bye.